Welcome, everybody, to the Obesity Matters Wellness Workshop, where we embark on an incredible journey towards better health and wellness. Whether this is your first time or you have been with us since we started this program a year ago, we are so grateful you are here. My name is Rachel, and I'm the Vice Chair of Obesity Matters, and I am your host for this year-long program. This is the very last session for this season. And we've saved a great topic for today, understanding weight regain, a positive path forward. I would like to start the session by welcoming Dr. Laura Reardon. Thank you so much for being our guest on this very special last episode for the season. And a great way to get started would be to hear a little bit about you and why you were inspired to be in obesity medicine.
Thank you, Rachel. And I'm really honored to be here. I was really excited when Preeti asked me to be a part of this. So I hope this is enjoyable. I think this is a wonderful topic that we're talking about today with weight regain. And I think we could also probably put plateauing in there as well, weight regain or feeling stuck with your weight with regard to weight loss. We can sort of put in that category, and it's certainly a really big topic. My name is Dr. Laura Reardon. I'm a medical doctor here in Halifax, Nova Scotia, and I've been doing bariatric medicine for about 15 years. I run a clinic here in Nova Scotia that is a physical clinic, but also a virtual clinic across the country. I think actually we were one of the very first comprehensive medical weight loss clinics in the country. And so I've been doing this for a long time. So I've seen firsthand the natural history of what it's like for people to heal metabolically. And so all the ups and downs and sides arounds and all of the things. So this is a topic very near and dear to my heart. I think my journey to obesity medicine was both professional curiosity and also very personal encounters with how weight and health and identity are so deeply intertwined. And I think that early in my career, I saw a lot of patients that were struggling with their weight, and not because they lacked willpower or discipline, but because they were fighting this really complex, misunderstood condition in a world full of stigma and quick fixes, right? And I think we still live in a world full of stigma and quick fixes. Despite emerging data, I almost feel like it's almost worse now. And I just think that I wanted to stand with those patients in that really vulnerable space, to have people understand that weight is not, it's about a complex health condition, and that healing isn't linear, right? We don't just fix things and they're better, that there is this very complex situation. And so this is the hill I die on. This is what I do and will be doing till I'm in my boots, and hopefully be doing it for a long time still to come.
Well, we're so lucky that you're here. Thank you for sharing that introduction. It really helps us all resonate with, how lucky we are to have someone like you that's part of this community and part of all of us healing. So again, thank you for being here today with us. So let's start with the first question. Many people believe that weight regain is about a lack of willpower. What does science actually tell us about why this happens? And why is it important to be able to separate that biology from the concept of willpower?
It's a great question. And I think it boils down to a number of things. So I'm a medical doctor and I take a very medical approach. And I think that combination of finding where, medicine meets compassion, which meets the complexity of our world, is really where the answer lies for this. So simply saying that people don't care enough or they don't have willpower is one of the most stigmatizing things around what is a very complex medical condition. So first of all, we have to understand that weight is a symptom, right? Saying that someone lives with weight is like saying someone lives with shortness of breath, right? Think of all the many thousands of reasons why someone might have shortness of breath, or why they might have flares of shortness of breath, or why they might have, remission of their symptoms and why they might come back. Right? It's a symptom. And there can be many, many reasons for why this symptom can be complex and challenging to treat. So think about weight, and whether it's a plateau in your weight or whether it's weight regain during treatment. I think it's really important to understand that our progress towards health is not linear. There are ups and downs. And I think if we plot everybody's journey, it isn't just this, I do this, I plug in this simple math equation, and all I have to have is willpower to maintain that equation, and the weight just comes off. And we all know that that is not the natural history for people living with weight. I think I really like to look at this in this very complex way, and every patient is different. We've got dozens of hormones, hundreds of chemical signals that influence whether our brains decide we will gain or lose weight. Hormones like leptin and ghrelin and PYY and GLP and insulin. And there's this really complex symphony of hormones that decide whether we gain or lose weight. It's not a simple math equation that we have control over. And I think that's something that's really important to understand. We also know that there's metabolic adaptation, right? Depending on how we lose and the circumstances of our weight, our bodies are constantly trying to protect us. Our bodies can become more or less energy efficient. Our bodies can shift into periods of time where our body goes into kind of starvation or scarcity and wants to hold and hoard, fat for protection. And then there's times when our body is in a state of plenty, right? Our brain can change gears. And so depending on that, our bodies can adapt to one place or another and can make us gain or lose weight. We also know that there's, very sophisticated brain reward pathways, hedonic eating, cravings. Remember, what we call hunger and the desire to eat is actually a really complex array of different things that we experience. We eat to meet our nutritional needs, we eat to meet our energy needs, but we also eat to meet our emotional needs. And helping to sort that out can be helpful for patients with regard to where their weight is going. Weight is a chronic medical condition. We don't just fix it, snap our fingers. There's a chronic nature to this that requires ongoing support for oneself, an ongoing, often changed relationship with ourselves. We also need to understand that there's complex lifestyle and environmental factors that can lead to weight plateaus and weight regain. Things like sleep and stress, our food environment, right? At the end of the day, we live as really ancient creatures living in a very modern world, which is quite pathologic. Right? The way we live, the stress levels we have, the very light in our houses 24/7. We're not meant to live with little pocket computers and let's fly around in CT scanners in the sky. And our food supply is rather pathologic. Often that pathology within the food supply is addictive. And so there's many factors in our lifestyles, culture. We know that loneliness, for instance, can play a big role in whether people gain or lose weight.
That's true. It is. We say that so much here, that everyone's journey will look different from one another. It is so important for us to see that there are so many factors. Yet I think a lot of us still go back to this idea that, is this weight gain a failure of some sort? Even though we know that, it's very layered and certainly a part of our weight, journey, whatever that looks like. But are there some ways that we can reframe that conversation from it being a failure to really just naturally being part of the journey?
It is a part of the natural human history of weight. It fluctuates, it changes. The weight loss process is not linear. So there is a natural element of your body wanting to protect you. And in certain hormonal states, or certain neurologic states, your brain is going to really try and protect a higher weight. And there's a natural process there. But I also think that we also don't know. And I just shouldn't say we don't know, but I think it's important to understand that there's lots of factors still in there. And so when patients hit a weight plateau, when they have weight regain, I think it's really important to make sure that people are losing weight in a compassionate, scientific way. I think we see a lot of people that are being treated for weight in not necessarily the most compassionate and scientific way, right? This is, people told to just, all you have to do is eat less and exercise more and you'll be fine, right down to here's some weight loss medication, see you later, you'll be able to lose weight, right? This oversimplistic way leads to a lot of challenges and a lot of weight regain and a lot of weight plateauing because people just don't have the appropriate knowledge for their own individual bodies. I think it's a combination of understanding that weight isn't linear and that there's going to be ups and downs with weight. But I think there's also needs to be a complex understanding of we need to do this the right way for that individual person as well. because I think one of the things we see in a really comprehensive medical weight loss clinic is we actually see people do really well. People can lose weight and they can maintain that over long periods of time. And as someone who's been prescribing weight loss medications for 13 years, we really see that people are able to lose and maintain if we take that very holistic approach.
Next question is around strategy. What practical strategies do you recommend for showing ourselves compassion and staying focused on overall health when these weight changes occur?
What are the practical strategies? So we have a philosophy in our clinic of overall, what are the strategies that ignite curiosity and decrease criticism? So it's interesting because in the psychological world, you cannot feel criticism and curiosity at the same time. So there's actually a recent study that showed that working on self-valuation, whether you like yourself, is actually a better way to get healthy than focusing on healthy behaviors. And that's a shocking thing, right? To think about that liking yourself more makes you healthy. But it actually is, I think intrinsically feels better and actually has a lot of evidence to it for being a strategy for healthy success, however that works, because everybody's very different. What healthy behaviors are is a little bit different for everybody, but feeling compelled to do those comes out of a source of self-valuation and self-compassion.
My next question is kind of related to sort of the tribe that we have around us, and how can our friends and family or even communities like Obesity Matters create safe spaces that reduce that stigma that, as you mentioned before, is still there and very strong, and encourage openness about this concept of weight regain?
Well, that is also an awesome question that I give a lot of thought to, because I've been doing this for so long. Advocating for my patients, for the people in my community, is just such a huge part of what we do. And I, am constantly advocating for patients in the community, with our governments and institutions. And sometimes it's great and sometimes it's really challenging. Because you guys know, groups like you guys, like Obesity Matters, are so huge for being able to make a change in our community. And I just am so honored to be here and helping you guys. One of the things we really talk about is changing and shifting the language. So the words we use, working on obesity bias and stigma, and helping people understand it's a chronic medical condition as opposed to just an aesthetic problem or a question of willpower. Normalizing the discussions around the biology of this, I think, is something that I personally feel really strongly about. Helping to educate, I do that a lot in, small groups and individuals, getting comfortable with that radical honesty piece in a safe space. And I think that's a lot of what we're doing right now with all of you, all 63 of you who are online here. I think we are creating a safe space. We are creating a culture of acceptance and helping each other when it doesn't feel like that. A place where we can express our radical honesty and anchoring a space of belonging, right? That we all belong together, that we're here, creating a sense of community, I think is really important. And those, identifying, not feeling alone and identifying with a larger group, I think is just so incredible.
Thank you, everybody, for being a part of this journey with us. As I always say, remember that our journey towards better health and wellness is not a solitary one. We are here to support and uplift one another. See you next time.